Perflow explores topics around healthcare, well-being, oncology, and integrative medicine from the perspectives of Dr. Paul Chen, a UK-based general practitioner who has a specialist interest in well-being, lifestyle medicine, longevity, and cancer care, and Dr. Wafaa Abdelhadi, an integrative oncologist in Egypt who specializes in functional medicine and applied metabolic therapy. The content is for educational and informational purposes only and is not a substitute for personal medical advice, diagnosis, or treatment. While we discuss evidence, professional experience, and reflective insights, listeners should always consult a qualified healthcare professional regarding any medical concerns or decisions about their health. Opinions expressed on the podcast are our own and do not replace guidance from your own healthcare providers. Every health journey is unique. We encourage listeners to take what resonates and seek support when needed.
Welcome to Perflow, episode 1. My name is Dr. Paul Chen, and we have
Dr. Wafaa Abdelhadi.
Excellent. And today we're going to kickstart the first episode about self-care. I wonder what we all think about self-care. It's a bit of a hard one, isn't it?
Yeah, absolutely. Like you think that you are taking care of yourself, but you are taking care of everyone around you, being a doctor mainly. And for me, add to that being a mother. And then the last thing you look at is yourself. So what can we do about this?
It's hard, isn't it? I think we're all so busy in this day and age, a lot of stress. I think we're trying to do the next thing, and often we forget to be kind to ourselves. And I think it's just the time to reflect back on how we operate and what we want to do, I guess, in terms of keeping ourselves healthy. It's about well-being. It's about also longevity, but not just the length, but also health span. I think it's really important to then realize the fact that in healthcare, we all know that sometimes it becomes a bit reactive. Because you come to see myself as a GP or Wafaa as an oncologist, and at that stage, the disease is there. Yeah, and it's not about, well, what can I do before that? And it's just we want to dial the needle to the far left to then say, okay, what things can you do in terms of self-care? So, Wafaa, what do you do? What sort of things do you do?
Well, let's take it a step backwards, okay? So people might think that you and me are, we're doing this podcast. We must have a lot of time to spare, but we are actually doing this out of passion, out of self-care. Actually, our first episode, the introduction episode, the breaking the ice one, I actually heard it 3 times because, can you please, Wafaa, listen to yourself and do what you asked people to do. So if I have a look at myself in 2003, being in the oncology department, seeing 30 patients per day from 8 in the morning until 3 p.m. And then we take a break. We grab a bite, of course, a delivery. Back then it was McDonald's. I didn't know anything about, it was fast food in general. I didn't know anything about nutrition because they never teach us anything about nutrition in medical school. That's in Egypt. And I don't know about in Oxford. That's what you're going to tell me and reflect. And then after this very nutritious, as you know, fast food meal, we then take a night shift or go back home after a few hours after we've finished everything with our patients' files, and it's all this way. And then maybe people who work at the hospital later on, after a second year, I worked at the private sector as well. So I worked in the public sector in the morning, in the private sector at night, and I used to go back home at maybe 12 or 1 a.m. in the morning. So this is me back then in my 20s. And then when I was lucky enough to train at St. James's Hospital in Leeds in 2004. And when I compared, yes, there were a lot of patients. We were very busy, but it was at a slower pace, I believe, from what I have experienced. Fewer patients per day. You have to have your lunch hour. It was a must. Nobody barges into your room saying that you have to see me now. So I was extremely busy during my training at the NHS, but I had some more me time. I would have at least a decent lunch. So what is your perspective from when you were a resident?
Wow. Bittersweet memories of carrying the bleep. The running joke for the listeners is that we used to have these, maybe, I don't know if we still use them, but these bleeps that call us to the ward. And I still remember as a junior doctor once that I was carrying 3 bleeps. So hall for the general ward, the DVT clinic, and I think neurology or something as well. And it just kept on bleeping, bleeping, bleeping. And remember one Christmas, it's like Boxing Day or something, the running joke was that my kidney function was probably worse than the patient's because I didn't even get the chance to go to the bathroom. So those are sort of bittersweet memories. But I think in terms of self-care, I think it's really important. I'm a firm advocate of the old school way of see one, do one, teach one. I think when it comes to lifestyle medicine, and particularly when we're talking about things that we can, I guess the actions that we can take, it's all good for me to mention it. If I'm not really doing it myself, I'm like saying, well, how are the patients ever going to be able to do that? The interesting thing, I think last week in our introduction, I said that I was going to hopefully sort of optimize my sleep. And I have tried it. So yesterday I went to bed around 11:30 for a change. And I woke up around 9 o'clock, 8:30, 9 o'clock. And that's like a meaty amount of time for me. And that never, ever happens. What are the benefits that I can feel at the moment? Well, I do feel sharper. I'm as excited. But it's interesting because you can't necessarily know what you don't know. And this is the problem sometimes with the aspects of self-care, particularly if you're not just in the survival mode, but when you're in the thriving mode. I think it's hard to appreciate what you would have experienced negatively, what you've now mitigated, doesn't resonate because it's not tangible. I think that's very complicated words. Essentially, what I'm trying to say is you don't know how you might have felt negatively if you've acted positively. And I think prevention is very difficult in that respect because it's not very tangible. And when we talk about self-care, I think it's you feeling good at the end of the day, and it's how you feel. And there are things that we will talk about in terms of the nice acronym, what is it called? To be the responsible individual, take your meds, and learn to be the happiest you. And a bit of a pun there, but the take your meds isn't physically more drugs. It is to do about your mindset, doing exercise, be it physical activities or movement, diet, of course, in terms of nutrition, managing stress, which is really critical, sleep, and social connections. And when you do that, it can also equate to about happiness, but also the ability to you then to needing to learn to become your happiest you. And just focusing on sleep is quite interesting because I was only just reading about it recently to then saying, in terms of the importance of all these attributes, what are the most important ones? And I think it's highly nuanced, this lovely word saying it's not black and white. And I know Wafaa and I love this word. But it's quite surprising because
Sorry.
Yeah,
Remember, I had my husband getting into one of our conversations to get us the nuance word.
absolutely. And the word is fantastic because it sort of reflects what medicine is about. Medicine is not always a black and white. There's obviously the hardcore science of the medicine. There's the art of the medicine, which is equally important. And therefore it becomes nuanced. And of course, as clinicians, Wafaa and I myself, we can treat patients, but sometimes it's important for the patients to have that awareness to then say, can you become the responsible individual to take those steps so that perhaps our roles are a bit of a partnership. So we want to help the patients, but also patients have to meet us halfway. And so this Perflow podcast, I think we're going to get really excited about trying to empower the listeners to be able to have that ability to start nudging into their own self-care, be able to self-help, be self-reliant, and also hopefully have that self-awareness, self-acceptance, and that self-actualization. Wafaa, what are your thoughts?
Well, actually, I want to comment on it by, you said you had elevated kidney functions. I had elevated liver functions. So the thing is that back in residency, so I'm just going to comment on this to tell you how serious it is when you postpone looking after yourself. Back then, during the residency, nobody actually told us how to look after ourselves. But now that we know, and we have the power of the internet and AI machines generation, that what I mean, we really need to look after ourselves. Back in the residency, I had elevated liver enzymes. I was extremely fatigued. I barely slept. When did my liver enzymes? They were elevated. I thought I might have encountered like a virus because I used to like cannulate the patients and do blood samples. I did the blood tests. I had elevated liver functions. My viruses were negative, thank God. I did an ultrasound. It's fatty liver. So what I did is that I stopped eating fast food and I started exercising. I made some time for myself. By the time I finished my residency, everything was fine. And then I got introduced to my husband. Then I got married. And then all of the whole 9 yard happened, having children, etc. Then I went back into the non-self-care mode. Back then, I didn't test my liver functions, but I knew that I messed them up. And there is a Korean study that I shared with you a few weeks ago, Paul, about how long hours of working, non-exercising, can actually elevate liver enzymes. And this was a Korean population. So I think it works for me as well. And then a few weeks ago, I was working really hard and I checked my liver enzymes and they were extremely elevated as well. And this shows that if I don't take care of myself, I will actually end up having a non-alcoholic fatty liver, and that will lead by stage 1 fibrosis of the liver, ending up by liver cirrhosis. So why should someone do this to themselves because they are trying to help other people and the people surrounding them? Like, my intention is fine, but why does stress can implicate all of these negative effects on the body? This is for another episode, okay, to talk about stress completely. But the thing is that, as I promised you from last week, I will walk every day in the morning. However, I skipped 3 days. I played paddle tennis instead. However, however, my take home messages is that I have been blessed by a wonderful friend. Her name is Patricia Daly. A lot of people know her. She was living with metastatic uveal melanoma, confined in her eye for 16 years. She was a banker, a marathon champion. And so she had in 2008 her melanoma in her eye. They did radiotherapy. She had the recurrent after 2 years. She did brachytherapy. And then when they told her that we're going to take your eye out, inoculate your eye, she told them, thank you very much. She actually quit her job and studied nutritional therapy. Patricia was able to maintain a very aggressive cancer in her eye for 16 years by self-care only. And the social media and everywhere, and people can ask me and I can show them. She was my living miracle, my living proof that self-care actually works. When you look after your body, the body will look after you. So I used to call her, and you know how a chatty person I am, Paul. I call people all the time and message them, my friends especially, of course, not all the people. However, she would tell me, Wafaa, I'm sorry, but I have to talk to you after my afternoon walk. So we have to make pauses for ourselves. Because if we are in sympathetic overactivity all the time, our immune system cannot tolerate it. We will not be able to recover from that continuous non-stop sympathetic overactivity. It will increase the cortisol level, and by increasing the cortisol level, on the long run, it will dampen our immune system, and it will cause something called autoinflammation in our body. And that autoinflammation on the long run will lead to autoimmunity. We can explain this in another episode, but it is, what I want to say is that self-care is not selfish. Like, you have to take care of yourself before looking after the others. You can do both at the same time, but sometimes people, according to their personality, you know this from just sitting in front with the patient, or you know this from looking also into their nutrition genome, they cannot handle multitasking. However, when people can handle multitasking, they push their limits too much and they think that they can do it, but they can't. You have to put on the brake, put on your seatbelt first, and then advise the others and then put the seatbelt, or in the plane, you put your oxygen mask on before the others. Now, we're not talking about planes crashing here or something, but your plane will crash if you don't take care of yourself.
Absolutely. Yeah, it's an interesting thing that you're mentioning, because it sort of reminds me of some of the conversations that I have with patients. Of course, I've been obviously privileged to help thousands of patients in my time, and often, of course, the classic one is if there's a chest infection, there's crackles using the stethoscope, they've got a fever, we'll treat it with some antibiotics. But more often than not, I think a lot of the conversations sort of are wrapped around the idea of stress. And stress in itself is a big problem. And I think this is where the self-care really should feature in terms of how you then go about managing stress. I think, as Wafaa mentioned, we'll probably take a really big deep dive on stress in a separate episode. But I think it's just that, again, that realization to take a moment to pause, to then think, okay, am I doing the stuff that I probably ought to be doing? If not, why not? Or if you are, well done. And it's just important to then say, okay, well, what other things can I do? What sort of things are, I guess, doable? What things have I not done so far? And sometimes it might be about making sure you have an accountability buddy to do it together. It might be just then saying, go for that walk. All of these things are really important. And I think in my consultation, I try to feature that in for about a minute or two. But of course, we're very time restricted. And of course, being very reactive in itself, I find it very difficult sometimes to put the focus to get that patient to have that realization. I mean, essentially, it boils down to intrinsicness. So even with we touched upon very briefly about habit formation, it has to be intrinsic. So the patients need to want to change. And so the self-care aspect is also one at this stage, is that realization that it is important. And then it's you wanting to focus on your own self-care. And I think that's really important to, whilst Wafaa and I can give us lots of examples of our own personal accounts, and lots of them, we're just one individual. And of course, as the listener, you have your own issues, past, present, and future. But it's then being able to then say, okay, well, what can I do? What action plans are there? And so hopefully we'll be able to empower you with just even planting a seed to get you to think about things. Far ahead, Wafaa.
So let's wrap it up to what can someone do after listening to this episode? To first thing, like very small baby steps into self-care. Let's hear it from your point of view, and then from my point of view, and then we'll...
Yeah. I think the basic ones are, I mean, the easier ones are, let's say, I don't know what the science is now. It used to be said that you need to walk 10,000 steps a day. I think the science is, I think it could be somewhere between 6,000. But in reality, having spoken to a movement specialist, any amount of movement is good, right? So if you can do 5 minutes, or if you're already doing half an hour, can you nudge it so you do an extra 5 minutes? Something simple. I think movement is an easy win, relatively speaking, as a starting point.
If they hear 3 episodes from our Perflow podcast, they will be able to walk 40 minutes.
Oh, easily.
Yes.
Well, we'll build in some accountability to make sure that the listeners have done it, right?
Absolutely.
So similar question back to you. What do you think, Wafaa?
Yeah, I think, so during COVID, after having 3 children, total 3 children. So in COVID, I had my 3rd child just before COVID. And when they did the lockdown, we started walking around the house. So I want to tell you that I was breathless the first 20 minutes. So I just want people not to take walking as a challenge. I know some listeners are marathon runners, and someone have never run in their lives. And some of them, they are afraid to try and walk. So I believe that if they start with 10 minutes and they see how do they feel, or 15 minutes or 20 minutes, depending on our episode length, at the one that they're listening to. So I think that they should start and see if they can walk with someone and they are talking breath without having to catch their breath with like ease, then they are able to push their limits for extra few minutes. And then I believe that if they can do something like, I once sent to one of my patients Jane Fonda's video, the walking video, that you can just put it on YouTube, on the TV, and do like a 10 minutes workout with Jane Fonda. How wonderful is that? And I didn't give them her video when she was 20 years old because they would like go crazy. I gave her the video when she was like, I don't know how old is she now, like 75 or something. So it
Our
is,
younger listeners might not know who Jane Fonda is, by the way.
well, they have to Google it. Yeah. So anyways, I think that first thing in the morning, they should drink like a big glass of water. So they have to hydrate, 1 or 2 glasses of water. So they have to hydrate for their overnight fast. Okay. And then they should get out of the house and just walk. I don't know how will they, like for me, I walk after I drop my kids to school. Some they don't have kids, some they walk their dogs, but they have to do this before starting their work. If you are late for your work, wake up earlier. That's it. This is a must. If one thing that you can do is wake up, take a glass of water. People like to put like a squeeze of lemon on it. Do it. People like to take a teaspoon of honey. Do it. Whatever you do, take 2 glasses of water and start and get the hell out of the house. Walk. If you cannot get out of the house, put on the Jane Fonda walking workout. So this is the first thing I like. We have like Patricia taught me so many things, and but we just one habit today is get out of the house and walk before you start working, and concentrate on your breath. Breathe well, because sometimes even when I'm walking and I'm thinking a lot, I forget to breathe.
Yeah.
So you have to walk,
That's so true.
breathe,
Yeah.
enjoy the walk.
Yeah. I totally agree. I'm quite excited because after this episode, my plan was to do a doggy walk, and so with intention, I will make sure to focus on enjoying it, not to overthink, but to also be attuned to my surroundings, whether it's the smells, the noise, the ambience, the sunlight. Amazing today. It's not raining in the UK. I think it's been raining for the last 3 weeks, and we know that can dampen our moods, I'm afraid. And think about things that are positive. And I think it's important that if we can lean into these sorts of, I'm not saying we're going to gamify everything, but the knowledge of what Wafaa just said, sometimes listeners may think, oh, I can't remember which order do I need to do that, as well as that. What does it have to do in the morning? Doing something is bad. Doing something is better than doing nothing. Right. So even if it were that, okay, you couldn't wake up because, I don't know, you're a night owl for argument's sake, and you think, oh, after work, can I then go for my walk then? That's fine, right? It's the doing bit, the action bit that's really important to begin with, and then being able to sustain that and to normalize that. So my take home for what Wafaa is saying, and given that we're talking about walking very briefly at the moment, is I will definitely enjoy the doggy walk, and I'm sure the doggy will like me back for that. So there'll be a bit of pet therapy going both directions. It's therapeutic on both accounts.
Absolutely. It's been a pleasure every time that we're together.
Well, on that note, I hope the listeners can think of one thing that they can do. And of course, there are going to be lots of episodes on similar things that are hopefully will nudge you to take those important steps. So on that note, we will see you hopefully soon. All the best.
Au revoir.